In this video, I'm going to show you how the solo treatment mode works and how you can continue to take your therapy even if no treatment companion is available for a session. It's important to become familiar with both treatment modes before you begin your sessions. This way, you'll know how to take advantage of either mode when the need arises. Before you take your therapy every evening, 1 hour before bedtime, you will log in and click on the Begin Next Exercise button, which is right here. This takes you to a new screen which prompts you to indicate whether you will be taking your therapy with or without a therapy companion. Part of the rationale behind the solo mode is that even when there is no treatment companion available, you will still be able to take your therapy session. The uninterrupted flow of the session exercises do not change just because you're in solo mode. Even though there are a couple of adjustments you'll make in the sessions, they're easy to do. In the companion mode, your treatment companion scores your responses as soon as you repeat each word, phrase, or sentence. In the solo mode, Neurova records your responses and then plays them back to you after your exercises are completed. Then you score your own results. If you recall the instructions about the additional exercises of a short list called 5s and 10s, you'll be making that list yourself. Other than that, the session will be just as easy as in companion mode. So on the screen here you would click Solo Mode. Let's look at the next screen. Here, Neurova is building your therapeutic exercises. This is a very complicated process which takes a couple of minutes. While you're waiting, you'll be able to review very helpful information. Each time you're on the screen, you'll have access to recommendations, tips, and specific advice that are valuable to you at your current progress level and in general. The timeline you see here keeps track of where you are in the process. Remember that your highest levels of improvement in comprehension will occur at or after 12 weeks of therapy. Your success is partly dependent on whether you take your therapy as prescribed and when prescribed every day. This means that the days you miss are counted against your progress. Miss a day and you move back. In the retraining, renewing, and restoring process, the brain positively reacts to the sequences and structures of the therapeutics. When you miss a day, you change the dynamics of the rebuilding process in the nerves. When you miss sessions, your therapy will take longer, which is exactly what happens with any other type of medical therapy. Lastly, at the very bottom of the screen, take note of the status area. It keeps you informed about what Neurova is doing at the moment. When the exercises are ready, the calibration screen appears. It prompts you to calibrate the sound level of the therapeutic exercises. It is easy to calibrate or adjust the volume of your computer speakers. When you purchased your Neurova treatment subscription, you received a sound meter. You will use it when the calibration screen appears. It's simple to follow the instructions on the screen. First, turn on the sound meter. Next, make sure you are seated approximately 3 feet from the speakers. Third, hold the sound meter close to your head. Fourth, click the Play Tone button on the screen. When the tone sounds, check the display on the sound meter to see how loud it is. And sixth, adjust the volume on the speakers until the sound meter reads 65 decibels. When that's done, click the Continue button. After you've made that adjustment once or twice, it'll become automatic. Next, you will see the Solo Mode exercise screen. You'll notice a message box in the center of the screen. When you hear the word to be repeated in the Solo Mode, it will not be displayed like it is when you're in the treatment companion mode. So, when you're ready, click the OK button to begin the session. The Neurova voice will prompt the patient by saying, "Repeat the word," and then say the word, which the patient will repeat back as quickly as possible. For example, the patient will hear, "Repeat the word free." Here is a step that is unique to the solo mode. A message will appear asking you to press the spacebar on your keyboard and hold it down while you record your response. When you have repeated the word, release the spacebar to stop recording. Then click the Next button and wait for the Nerova voice to provide the next word. Just like the companion mode, the system keeps track of the word count for you at the top of the screen, here. Here is another step that is unique to the solo mode. When you have finished the last exercise of the session, the next screen allows you to score your own responses. Here you will see the word and hear your own recorded response at the same time. If you need to hear your recording again, click the speaker icon. You will click either yes or no to indicate if you repeated the word correctly or not. When you have repeated the last word in the session, your screen will display your results. Depending on the kind of session you have just finished, this screen may or may not have only the results of the session, but other information as well. Notice the missed words section here. After each session, select either 5 or 10 words from this list. They'll be used as an additional exercise to supplement the day's session. After each session, you should create this short list of words. Anytime during the next day, take the time to repeat each word multiple times out loud. Throughout the day and when it is convenient, take a minute and select one word. Repeat each word quickly or slowly, and either loudly or quietly, but repeat every word every day. It is important to vary the way you conduct this self-paced exercise. If your list has 5 words, repeat each one 10 times, one right after the other. If you have 10 words, repeat each of them 5 times during the day. After you have reviewed the screen, please click the Save button. The last screen is one that advises you when to take your next exercise session. You can conduct multiple sessions at any time, and it will certainly help to do so. But the most important thing to keep in mind is that your main session must take place 1 hour before bedtime. This is because the brain's rebuilding period is activated while you are asleep. In the daytime, your supplementary exercises will help you to consolidate both types of memory that are highly dependent on healthy synaptic junctions to assist you to rebuild your fluency. The more you do, the better you'll do. It's important not to become frustrated if you respond incorrectly. There are many reasons why that is to be expected, even if you think you should be doing better. Stay focused, stay patient, and recognize progress when it does occur. When you click the Continue button here, it takes you back to the main screen where we started.